I want to share a letter that I received from Governor Tom Wolf, who's governor of the great state of Pennsylvania. I've become very concerned of the effects of this bill on our Medicaid expansion program. Governor Wolf wrote me to express his concern regarding the American Care Act. He has urged us to vote no on this bill. I know he has sent copies of this letter to other Pennsylvania members. He said, in short, it will have a devastating consequence on our economy and our constituents. The legislation as it stands today would disrupt health care access and coverage for millions of Pennsylvanians. Currently, there are more than 2.8 million Pennsylvanians enrolled in Medicaid, more than 700,000 of whom have only recently been able to access Medicaid through the expansion that he put in place when he became governor in 2015. Of the people in the expansion population, 42,738 of them live in my congressional district. More than 1.2 million of the 2.8 million Medicaid enrollees are children. 387,000 of them are between the ages of 0 and 5 years old. There are more than 248,000 seniors receiving health care through Medicaid in Pennsylvania, and the program supports over 30,000 individuals with intellectual disabilities and autism so that they can live in their own communities as well. In his 2017-18 proposed budget, $18.5 billion of the total Medicaid budget, that's 62% of the budget, is going to be spent on older Pennsylvanians and people with disabilities. The proposal that we're considering here in Congress would freeze Medicaid enrollment for low-income adults without dependent children beyond 2020 and convert Medicaid to a per capita allotment using fiscal year 2016 as a base year with sanctions for states spending higher than their targeted aggregate amount. If the amount of federal funding for the expansion population is reduced, Pennsylvania's Department of Human Services estimates the cost of covering the more than 700,000 individuals in the expansion population would be $2 billion annually, not considering any adjustments for cost increases or inflation between now and 2020. In our current economic climate in Pennsylvania, this is simply not a cost the state can absorb. We will be forced to ration care for our most vulnerable residents, pitting seniors against individuals with disabilities, against sick children, in a race for who is sicker and who needs care more immediately. Separate and apart from Medicaid, more than 413,000 Pennsylvanians have signed up for coverage through the health insurance marketplace as of January 2017. 75% of those marketplace customers are estimated to be able to find a plan in 2017 for less than $100 a month as a result of financial assistance. Subsidies available through the Affordable Care Act currently offer protections for individuals living in rural and other areas where premiums tend to be higher. But the proposal that's being considered in Congress removes those subsidies for individuals based on income and geographic location and instead allocates tax credits based on age. This will have the disproportionate and unintended effect of increasing costs for some of our most vulnerable residents, most notably seniors, while decreasing costs and creating incentives for wealthy individuals and insurance companies. Seniors represent one of the fastest growing populations in Pennsylvania, and shifting the burden of expensive health care costs on them to offset costs for the rest of us is unfair and disingenuous. These are individuals who have lived and worked in our communities, sometimes their entire lives, and they will suddenly be at the mercy of health insurance companies who will no longer be restricted from charging them higher premiums than the rest of us. More than 2.9 million Pennsylvanians are age 60 and over, and research shows that nearly 70% of them reaching age 60 are expected to have long-term care service needs at some point in their lifetime. The American Health Care Act would cripple our state's ability to cover optional services currently offered by Medicaid, like prescription drug coverage and inpatient psychiatric care for individuals under the age of 21.